Hi, Dr. Lee again from here at Live in the Big Easy in New Orleans at ASH 2022, updating you on the hottest abstracts for Hodgkin's lymphoma. As I presented on Saturday morning or Saturday afternoon, depending, uh, we were able to present to you one of the most critical abstracts in Hodgkin's lymphoma, in advanced stage classical Hodgkin's lymphoma. So let me uh, talk to you guys a little bit about this protocol and the exciting data that is coming out. As you know, advanced stage Hodgkin's lymphoma uh, is a curable cancer. However, many of the patients still have long-term toxicities secondary to the chemotherapy they have received. So what we're trying to do is to try to minimize some of these toxicities of long-term complications of chemotherapy, at the same time improving our possibly the efficacy of the treatment option. So, in the United States, ABVD has been the standard of care. Obviously, across the pond in Europe, escalated Biacop has been popular in the European countries. However, in the United States, ABVD has been the most common. And we have seen the new data from Echelon 1 showing that BV AVD has shown an overall survival benefit against ABVD chemotherapy. Now I am presenting to you the brentuximab nivolumab AD, dropping of the the VIN blasting in order to improve the toxicity of this regimen in hopes we can increase the efficacy and the cure rates that we currently see. So this study, as you know, is the combination of brentuximab, which is an CD30 antibody drug conjugate that has shown efficacy in relapsed refractory classical Hodgkin's and in the upfront advanced stage classical Hodgkin's lymphoma in combination with AVD. Nivolumab has been approved for classical Hodgkin's lymphoma for lines greater than 3, including autologous transplant. There has been multiple studies combining the BV plus the nivolumab with great safety and efficacy. And now we have hypothesized that this combination, along with a backbone of chemotherapy of AD, that we could achieve a even higher efficacy at the same time maintaining safety. So with that, we were able to move forward. We included patients with advanced stage classical Hodgkin's lymphoma, stages 3 and 4, including stage 2 bulky, greater than 10 centimeters in size. And they received 6 cycles of chemotherapy. And the primary endpoint of this study was complete remission rate at the end of therapy. And secondary endpoints, safety, progression-free survival, duration of remission, duration of complete remission, and safety. With that, we had a very exciting group of patients, more than 55 patients enrolled onto this study. And we were able to have about more than 50% of the patients were stage 4, and greater than 50% had high or intermediate IPS scores. And we were able to see, in terms of safety, we did not see an increase in terms of adverse events that was commonly seen. And the most common adverse events that we saw were cytopenias and neutropenias and LFT abnormalities. In terms of immune-mediated toxicities, such as rash, hypothyroidism, which were consistent with that of the data with nivolumab single agent. In terms of efficacy, we saw overall response rates of 93%, very respectable. We did have complete remission at the end of therapy was 88%. There was one patient who had indeterminate response at the time of the data cutoff, but later on turned into a complete remission, which was not included in the complete remission rates. So we are very pleased. And the 12-month calculated progression-free survival was almost 95%, okay? And with a median follow-up of 17 months. So we are very pleased with these encouraging response. The ongoing long-term follow-up is still ongoing, but we are very pleased with the responses, and the patients will be continuing. Obviously, there's going to be the early stage Hodgkin's lymphoma with nivo BVAD that will be presented tonight at the poster session. So please feel free to come by and ask me any questions if you have. So thank you so much for listening to my abstract. And if you have any questions, please feel free to reach out.